Hello everyone, I'm really glad to be here. You'll notice my thick Slavic accent probably. I'm from a small country in Slovenia, I hope you know it. We were together in EU, if you remember the days when you were part of us. No, now I have to check that when the ETA something visa on the internet, but thank God it lasts for 2 years, but okay. So I've been using Karisma for quite a few years now. I'm an international key opinion leader for this great product. The first thing I always ask, do you know Karisma RH Collagen product? Everybody raise your hands. Okay, almost everybody. Do you use it often or not as much? Yeah. You like the results? Yeah. Your best treatment? Oh, you say that just because I'm here. That's because I'm standing here. If it was some other brand, you'd say, oh, this is the best one. Okay, all right, yeah, I agree. It's one of the best treatments. In my opinion, you can add Karisma basically to everything that you already do. You can just add this treatment. It has great effects, great value for what you can do for your patients. So Karisma has been around for quite a few years now. It's one of the, I always say that one of the few biostimulatory products that actually has scientific data behind it. So class 2 studies and everything. It's been around for, John says 4 years, I say almost 5 years. So it's been around for almost five years now. I'll say it like this. I've been using it for a big chunk of that time. So it's a part of my basically daily treatments that I do in our clinic. Karisma has grown a lot in a few years. It's become global. It's used all over the world. In Asia, they love it. It's an amazing product. They have a few off-label treatments that are quite interesting. Let's say the tear trough. We were all when we were in Asia in the summer, they were telling us, oh yeah, we do also the tear trough treatments. We were like, oh my God, how and why? And they love it. They have amazing results with them. You can't believe it. So to understand Karisma, we first have to understand collagen. We have to know what collagen actually is. And I think and hope you know collagen molecule. So collagen is comprises around 75% of the weight of the dry dermis. So it's a very important structure, very important molecule. It's a rigid structure. It's made of 3 chains, 2 alpha-1 and 1 alpha-2 chain. In order to be produced in our body, because we can only produce our own collagen. Okay? If we ingest collagen, it won't be absorbed as a molecule. It gets digested to amino acids, absorbed, and then restructured back in our bodies. In order for our body to be able to do it, we need vitamin C, so ascorbic acid, and alpha-ketoglutarate. So these are the 2 main substances we need in order to have collagen in our body produced. And Karisma RH Collagen does that. So Karisma RH Collagen promotes the structuring of new collagen chains. It's not a filler, okay? And it's a completely different type of biostimulator that we know. Why? Because it's the only product, the only biostimulator that doesn't cause inflammation. So we don't get neocollagenesis via inflammation path, but via direct stimulation of fibroblasts and some other mechanisms that we're going to talk about a little bit later. It's hyaluronic acid base. It's non-cross-linked HA, that is the main ingredient, main medium, alongside with CMC, with carboxymethylcelluloses. And the main thing, our MVP, is the alpha-1 chain, the recombinant human collagen alpha-1 chain. The goal of Karisma treatment is to reactivate fibroblasts, young fibroblasts and senescent, so old fibroblasts, to restructure collagen, to restructure extracellular matrix, and to regenerate, or maybe say repair, our skin. If you remember, there were in the past collagen treatments, collagen injectables available to do. They were mostly pork-based or bovine-based, so practically animal-based. You could also find some human-based collagen injectables, which are scary and dangerous. But also, if you look at animal collagen injectables, that's very dangerous also, because you get a lot of allergic reactions, a lot of inflammatory reactions, and if you're using bovine, we were talking about that yesterday, you can get prion diseases. So mad cow disease and all the other prion diseases. So it's very, very risky to use those kind of injectables. And Karisma has non-animal based and non-human based human collagen inside. How is that possible? So it's produced by silkworms. So what we do, we take the gene that promotes the transcription of alpha-1 chain, we insert it into the silkworm's genome, and the silkworm then in its glands produces silk, produces alpha-1 collagen, it's inserted in the cocoon, we take those fibers, the cocoon, we extract the recombinant human alpha-1 chain, and we purify it. And with that, we get the alpha-1 chain that it's 99.9% similar to our own alpha-1 chain, to our own collagen, basically. And with that, we get almost zero risk of allergic reactions, almost zero risk of inflammatory reactions. It's because it's monofilament, it's instantly bioavailable. So you don't have to, let's say, dismantle it and build it anew. It's there. It's viable, and the fibroblasts can use it. It's almost the same length, or let's say the same length, the same weight as our own alpha-1 chain. So it's what our body actually needs. Why is that important? If you take the whole collagen molecule, you put it a lot in the skin, a lot in the subdermal tissue, you will get the fibroblast will get the information, oh, there is the abundance of collagen. There's a lot of collagen. I don't need to work. I'm going to sleep. And then fibroblasts sleep. And when fibroblasts sleep, they sleep for 4 to 6 weeks. That is a turnover rate of those cells. And when the collagen that we put inside the skin gets degraded, gets washed away, the fibroblasts are still asleep. So we end up with a worse situation than before the injection. When we put just one chain, just one alpha-1 chain, this is not the end product. So fibroblasts get information, oh, I need something to do with that alpha-1 chain. I need to build 2 more chains. And they are activated, and they stay active for a long period of time. There are 5 mechanisms of actions of how Karisma RH collagen actually produces more collagen and enhances the skin quality. So the first one is direct stimulation of alpha-1 chain. Then we have the fibroblast activation because of that alpha-1 chain that's put inside. We have the third pathway, which is the most important pathway, is the activation of TGF-beta-1. TGF means transforming growth factor beta-1. So this is a very, very important pathway. We're going to be talking about this a little bit later, because it's one of the most important effects that Karisma actually has. Karisma also enhances and regulates the cellular proliferation, and it restores the extracellular matrix. So those are 5 ways that Karisma promotes and actually does the skin actually promotes the skin quality. I'll say it like that. So the TGF-beta-1 pathway, this is the mechanism of action which is the most important with Karisma RH collagen. So TGF-beta-1 is very important because it actually regulates the mechanism of cellular proliferation and collagen synthesis. It's heavily involved in the wound healing and tissue repair, and also in the controlled scar formation. Unfortunately, as everything, it declines with aging. So the older we get, the less signaling of TGF-beta1 we have in our body. So we have to promote it somehow. When we activate it, we logically enhance the collagen production in old and in young fibroblasts. We enhance also the remodeling of extracellular matrix. To have better extracellular matrix organization is very important, because whatever happens in extracellular matrix, so the better hydration, the better all the processes in the skin, in other cells. And we have reduction of collagen fragmentation, because if collagen is not a whole molecule, it actually doesn't work. It can't work. As I mentioned, in one syringe, we have also non-cross-linked hyaluronic acid. It's not because of the volume. It's not only because of the tissue hydration, which we need. Without the tissue hydration, there is no collagen synthesis, no elastin synthesis. But hyaluronic acid is important in orientation of collagen fibers. Because if you have disorganization of collagen fibers, then either you have a scar formation or you have no formation. So it's no use of that collagen if it's not oriented correctly. HA is also very heavily involved in antioxidative reactions and anti-inflammatory reactions. The CMC, the carboxymethylcelluloses, it actually preserves our own HA in the body, and it also preserves the HA that we put inside the skin with Karisma treatment. It also slows down the action of MMPs, the metalloproteinases. And we have the synergistic effect of three components. So we have anti-inflammatory, antioxidative, we reduce the tissue irritation, we have better bioavailability, because when you put hyaluronic acid alongside with those products, it actually promotes the bioavailability of the alpha-1 chain. So we have synergistic effects of those three components. And this is all evidence-based. Okay, we know that we have an increased collagen type 1 synthesis. We've proved that with ELISA scanning and with immunofluorescence. And we know we have cellular rejuvenation. And we've proved that with Antera 3D scanning. We know that we have improved skin quality. So it's better elasticity, better hydration, better tonus of the skin, better regenerative mechanisms. We have pigmentation balance, because TGF-beta1 is also heavily involved in melanin regulation. That doesn't mean that when you put Karisma, you will be able to treat the hyperpigmentations. But it's an addition to other hyperpigmentation treatments. If you use Karisma with other treatments, you can prolong the, let's say, returning of the hyperpigmentation, because some people are just prone to hyperpigmentations. And we have better tissue repair. If you want, you can read all of the science behind it. We can go through every... No. But what's you will see everything that was in those in those lectures. So with Antera 3D scan, Antera 3D scan is a great machine. It basically does the hyperspectral image. It's a hyperspectral imaging system. So it with different types of filters, we can see if the skin quality is better. We can see if there is a difference in scars, if there is difference in pores, and we've been able to prove that it's the wrinkle depth is reduced for 95%, and you can see that in the 3D scan photos. It's visible. It's visible to the naked eye, the difference after 2 treatments of Karisma, and the patients will notice that. They will see the difference, maybe not after the first treatment, because of the first treatment, you first get the hydration, it's the plump effect, it's everybody's happy. But the true change happens after second or third application of Karisma. That is where the magic happens, where there is a greater collagen synthesis. Because at first it's like with any other water treatment, let's say hydration treatments. You get the plumpiness effect for 2 weeks, and that's it. And you have the patient return, no, it's good, but can we do it again? And you will do it 2-3 times, and then the patient will say, I can't return every 2 weeks and pay that much money just for a plumpiness effect. And with Karisma, you get that long-term results. It's a marathon. The biostimulation, the regenerative medicine, as we call it right now, is a long run. It's basically really a marathon. You can also treat the neck. We'll be talking about some regions where we do not advise for your treatment Karisma, but you can treat the face, you can treat the neck, you can treat hands, and off-label other parts of the body also. But John, don't listen to this. You go out. Don't say anything to Filippo. And with ELISA scan, if you like the science, you can also you will also appreciate what ELISA scan actually does. You can see with immunofluorescences the actual difference in collagen quality and quantity. Again, we have the science. So, and the science is clear. The science says that when you inject Karisma, you get better collagen synthesis in young fibroblasts, which is logical. Whatever you do, if you just inject, you will get some sort of neocollagenesis, because the young fibroblasts, they react quickly. But what is very important is that we now know that we can also awake the sleepy fibroblasts. And that is proven with scientific data. You want to hear this, yeah? How to do it? It's very complicated. I'm not sure you'll be able to. I'm just kidding. I'm kidding. So we have a lot of different techniques. What I would like to say first is, don't inject Karisma too superficially. Okay? Karisma is meant to be injected into the deep dermis. Don't do the superficial papulas like with some, I say mesotherapy treatments. So don't do the visible papulas, the whitening, okay? Don't do that. You have to be into the deep dermis. I like to do it with the needle. If you do it with the cannula, it's also a really nice technique, because how many of you were involved in some kind of surgery, seen some kind of surgery? So when you do, let's say, a facelift, when you raise the skin, you see that there is also a very thin layer of, I won't say fibrosis, but collagen basically underneath the skin. So it's not only in the dermis, it's also underneath the skin. So if you inject subdermally, you also have good neocollagenetic effects. So even with cannula, you have a good result with Karisma. But why I like needle, if I want to improve the skin quality, if I want to improve also the wrinkles, because with direct stimulation, with direct damage of the skin when you inject, this is also a signal for repair mechanisms. Okay, so we get better collagen, or let's say more collagen synthesis with that kind of treatments. So the 10-point lift technique, it's called A-lift. Aljosa, A-lift. It's my technique. This is the Asians, they are smart. Elizabeth told me, this is the A-lift, the perfect lift. So how you do it? We can let's say draw a few lines, so for us to be easier to understand the techniques. The injection point. So the first line is from nasal ala to the hairline. Okay, we go alongside the zygomatic bone. Second line is for oral commissure to the tragus. Third line is alongside the jawline, okay, from the mandibular ligament to the mandibular angle. Then we have one line from the lateral point of the eyebrow to the mandibular angle. Then from lateral canthus to the premasseteric area, so you ask your patients to chew, and in just anterior to the masseter, you end your line. And the third line that goes from the mid-pupillary line to the mandibular ligament. At the crossings, you have your injection points. So this is point number 1, number 2, and 3. Underneath that, you get 4, 5, and 6. Alongside the mandibular border is 7. The 8th is on the. I can move if you want to. I'll say.
Where's the 10th one?
You will see. So the 8th is on the in front of the masseter. 9 on the mandibular ligament, and the 10 is here. Okay, you know the 10 point. The 10 point is quite often used, but it's a great point to support the area underneath the lower lip, and to support basically the marionette line, and to also support the tissues in the mental area. Yeah, you got the picture, everybody? Cool. Hard? Not hard. You can use the pre-packed needle that is already inside with Karisma syringe. It's 27 gauge. You can try with 30 gauge needle. It's you can do it, but it's the product is stiff, so you will need a lot of force. So it's better to use 27 gauge needle. It will be much easier for you and quicker for the patient. With the cannula treatment, you can treat with 2 injection points, 3 injection points, 4 injection points, however you like. I don't like to use needle on the forehead. For me, it's a dangerous area. Not because of any other big complications, but you can easily get hematomas here. If you get hematomas here, your patient won't be very satisfied. They will get heaviness of the eyebrow. The hematoma will spread downwards. It will look like they were in a fight, and nobody is very happy to have a hematoma for 2 weeks. So I usually use either 22 or 25 gauge cannula. With 22, it's going to be much easier. The longer the cannula, the less injection points you need. But the longer the cannula, the more Karisma gets stuck in the cannula. So whatever suits you. With 25 gauge cannula, it can be a little bit harder to push the product out. The cannula technique is very. You have a question?
Yeah, I do. Out of interest, I personally look at that and think about the fiber separation benefits, especially for the gels to lift. Would you say there's a benefit to using the cannula over that because you separate the skin, causing a little bit more trauma?
Of course, this is a subcision technique basically. So yeah, you can benefit from that a lot. So this is one of the things that you can also implement if you have, let's say, acne scars. Is basically the same thing. So with the cannula, I'll show the case later. With the cannula, you can actually do really good separation of those fibers. Of course, if the acne scars are not too severe, then you need the true subcision. You could also use multiple injection points. If you have, let's say, an area on the face that is heavily wrinkled, that is often in the perioral area, or in the mid cheek, when it's very hard sometimes to do it with a filler because you can get heaviness. It can look even worse. With Karisma, there is no risk of making the face heavy. The important thing is to be in the deep dermis. Okay, always in the deep dermis. you can use half ml or 1 whole ml on each side of the face, even in the small areas. The Karisma will spread evenly. The more you put in one place, the more swelling there's going to be on that area. So if you treat in the jowl area, or if you treat in the perioral, you will get a little bit of, let's say, more of a feeling of a heaviness because of the hydration of the tissue. But that lasts for 24 to maximum 48 hours, then it goes away completely. It's usually it's not visible to others, but the patients just feel it, just a little bit of water retention, which is completely normal. You can also treat the neck, the necklines with the needle or with the cannula. What's important here, again, to be in the deep dermis, okay? Don't inject the décolleté area, and I'll tell you a little bit later why. Just décolleté area is off-label treatment, okay? I don't suggest doing lower parts of the neck and the décolleté area. The skin is too thin, and you can get one complication that Karisma actually, let's say that. So the treatment protocol, the Karisma is pre-packed in a 2 ml syringe. I suggest you do it in, we say officially in 4 weeks time, but I say to my patients in 3 to 5 weeks. It's easier for them to schedule. You can do 2 sessions. 2 sessions is enough for most patients. For patients that have a lot of wrinkles, that have sagging skin, or need more tissue hydration, more collagen synthesis, you can also do a third treatment after 3 to 5 weeks. So you can space it in 3 to 5 weeks, 3 treatments, and then you repeat it every 4 to 6 months. You can repeat 1 or 2 treatments every 4 to 6 months. And with that, you get really great long-term results. And as I said, Karisma doesn't cause fibrosis. It doesn't cause inflammation. It produces the collagen that actually needs to be in the skin. It won't cause any scar formation underneath the skin as maybe other biostimulatory products do, which is not bad, okay? Sometimes we need very strong collagen synthesis. I'm not talking against any kind of other biostimulatory treatments. We just have to understand the limitations, and we have to understand what each product actually does. After treatment protocol is standard, nothing special. So avoiding sun exposure, avoiding strenuous exercise for 24 hours, avoiding makeup for 24 hours, and that's it. If patients want to massage it, they can massage the area. If they get some bumps, they can massage them, but in 24 hours, they're completely gone. For most of the patients, in a few hours, nothing is visible. And you can also promote and exocare. So Karisma doesn't have only injectables. We also have exosomes to apply after the procedure, and patients can do that at home. It's very good creams. I hate any creams to put on my face. The Karisma exocare is the only the only product that doesn't stay on my skin, that actually gets absorbed. And it's true. I'm not saying that because I'm a KOL, but it's actually true. I've tried a lot of them. I hate all the stuff to put on my skin. Karisma has a really great safety profile. We've never had any major complications like you can get with other treatments. We haven't seen any kind of granuloma formations yet. We haven't seen any allergic reactions yet, and any kind of other big health risks, let's say. As with other injectables, always hematoma, bruising, redness, a little bit of swelling, but that's completely normal with any kind of injectables. There is just one Karisma specific complication, and that is hypersensitivity to CMC. And that is mostly visible. I mean, we've only seen it in the décolleté area and the lower parts of the neck. Why? We're not so sure why. Maybe, and we're assuming that is maybe 2 superficial injections. or actually telangiectasias due to reaction to the CMC. Why telangiectasias? Because it was very, very easily treated with IPL lasers. But otherwise, if you see that kind of reaction, you can try first saline irrigation to wash out the remaining CMC if it was injected too superficially. Tacrolimus ointment, but this is immunomodulatory treatment, so we need a prescription for that kind of ointment. And the IPL laser that has been proved in some cases to be extremely effective, and it's visible like this. I hope you see it on the screen, but it's the red dots on the decollete area and lower neck. But again, it usually is self-limiting. If it's self-limiting, it stays there for up to 6 months. Sometimes a month or two more, but until now we've been able to treat every case till now. Maybe something surprises us in the future, but for now it's been really great, and it's been proven very safe. A few of the clinical cases. Ian, the first one is for you. This handsome gentleman is my little brother. Yeah, he's 10 years younger than me, and he had, let's say, a lot of acne, and you see the results of not using any kind of products and retinols, and it's like this. So he came to his favorite doctor, of course, had to do something with my skin. And actually, I think he's been the first patient that I've treated for acne scars with Karisma. But in my opinion, there is no one product that can treat everything, and that can be the main thing in treating especially acne scars, which is a very, very hard case to treat. So what I did here, I combined Karisma. I did 4 sessions of Karisma. The first one was with the cannula. I did everything in local anesthesia because it can be very, very, very painful to do a subcision like this. So first I did with cannula. Then the second treatment was with the needle. Again, direct subcision and injection in the acne scars. Then it was a Q-switch laser, Karisma again, Q-switch laser, I think one more Karisma, and 2 rounds of polynucleotides. Everything was spaced in 3 to 6 weeks, depending on his availability, and the treatment lasted for a few months. But the end result was like that. This is a non-edited picture. I know is a different angle because the second picture was taken in our dermatologist's office. But this is the difference of the before and after. But it took us a few months. I think it's 7 or 8 months, the whole treatment. But it's a great result, and he's very happy, very satisfied, of course. You can see the difference with 2 Karisma treatments already, especially in this fine perioral lines when it's hard to treat. Yes, of course.
Was the previous treatment performed with all of those technologies at one session?
No. Everything was spaced 3 to 6 weeks apart, depending on his time, his availability, and depending on the skin repair. Let's say on how the skin was reacting to different treatments. So let's say after Q-switch laser, we spaced it around 5 to 6 weeks apart. After sessions of polynucleotide, it was 2 to 3 weeks. I adjust the protocol regarding how the skin is actually reacting.
I think it.
So going back to the perioral, those are the areas that are sometimes harder to treat with other treatments, and with Karisma you can easily do a direct injection into those problematic areas, let's say. You can use Karisma as a multimodal approach. The patient here was treated with Botox with fillers, and then with Karisma to improve the skin quality. Believe it or not, the patient on the left was 38 years old when she came to my office. Yeah, very bad. Yeah, but it's true. But very bad skin quality. No previous treatment, just lip filler, of course. And she said, "I want a facelift." I said, "It's too early for a facelift. I won't do a facelift to you. Let's try with some other treatments. Facelift we can do later. We can do it in a year or in 10 years, however you wish." We went through a long process with all the treatments, but at the end, she's still my patient. She's still coming to me. Probably we'll have to do a facelift sooner or later, but the skin quality has improved so much.
Mm-hmm.
We're doing Karisma treatments basically every 4 to 5 months, and the skin quality in a few years has improved drastically. You can see the
Sorry,
yes, yeah.
Right. So when you do the one and then you space it out by 4 weeks, and then again, say the third one.
Yeah.
Then do you then leave it for 6 months and then do another course of the 3?
No.
With this particular client, or do you just do one? And
Just
then wait
one.
And then, okay.
Then
Then you wait another
yeah.
4 to 6 months
Yeah.
to do another one
To
again.
do another one, yeah.
Okay.
Usually what I see is that I do botulinum toxin treatment and Karisma in the same session, because it's spaced in a similar interval. So usually when patients come for a renewal of botulinum, then I also do the Karisma treatment. But maybe I wasn't clear enough before. You can do Karisma in the same session with botulinum toxin or in the same session with fillers. Okay, it's not contraindicated. You can do it at the same time. The only limitation is the possible swelling. The more treatments you do, the more edema you can get on the face. So we have to think pragmatically. If you treat the patient with 3, 4, 5 ml of filler in one session, then of course you won't do Karisma or any other treatments. You will space it for at least 1 to 2 weeks apart. But otherwise, Karisma, you can combine Karisma with everything. Don't do it in the same session with other biostimulatory products. Okay, that's the only thing that I want to say. Don't do it with calcium hydroxyapatite or PLLA in the same session. Otherwise, you can combine it with everything. So you can also see after a few treatments of Karisma the improvement of hyperpigmentation on the forehead. The neck area can be really easily treated with Karisma. As you know, with some other biostimulatory products in the neck area, it can be quite tricky because of the possible granuloma formation. The skin is very thin. If you put other biostimulatory products, you could end up with some complications and unsatisfied patients. But with Karisma, you don't have the risk of granuloma formations. So Karisma can be easily added to your existing protocols. Okay, it's not a treatment that you must take some treatments out and put Karisma in. No, Karisma is an addition to your protocols that you already use. It's completely biocompatible. It's 100% satisfaction rate of the patients. No, you always get some patients that will tell you, oh, the treatment is not okay, it's not fine. Do another one, but for free. It's something like that. So I always like to say that it's a next generation injectable. For now, we don't have a direct competitor yet. So somebody's calling someone. Wasn't me. It wasn't me. And you basically can't go wrong with Karisma. So you can use it practically wherever. When the camera is off, I will tell you the other areas that you can treat with Karisma. Don't forget about the ExoCare. ExoCare are great products. we have serum, cream, and scrub. Okay, those three things can be easily added to existing protocols. Oh, did I get it in the goodie bag?
You will get your goodies.
No, if they got the goodie bag, I have enough products for me. Trust me. Try it. Try the ExoCare. You will. I'm sure you will love it. I like to finish my presentation with what I call "I like to be smart." So today's aesthetic medicine focuses and prioritizes natural restoration over artificial enhancement, and that is what Karisma actually does. All right. I'd like to start with 10 points. Okay, I think this is the technique that interests you the most, probably. Yeah. It's very hard to achieve. I'm just kidding. So, as I said, we're going to draw a few lines just in order to be easily understandable where the points are. So we first go from nasal ala alongside the zygomatic bone to the hairline. Okay, so this will be, is it visible? Because I can't look both ways.
Yes,
This is our first line. The second line goes from tragus to the mouth corner. So this is going to be our second line. And the third line goes from the mandibular angle basically to the, we can draw it to the chin. Then we have a line going from lateral brow to the mandibular angle. We connect those 2 points. Then we have the third line going from lateral canthus towards squeeze-your masseter. True? You did. Do you have Botox in your masseter?
No, never.
Nothing. She doesn't have a masseter. So it's around here. We go from lateral canthus downwards, and from mid-pupillary line we go 2 or 3 millimeters laterally, and we connect it with the mandibular ligament. And we have our 10th point here. So we have 3, 3, 3, and 1. That is 10. Okay, perfect. And those are the, I always say, approximate injection points. You don't have to draw them every time you inject, okay? Those are approximations in order to spread the product as evenly as possible in the lower 2/3 of the face, okay? Why lower 2/3? Upper third you can treat with botulinum toxin very effectively, okay? So the main areas of concerns in most patients are the lower 2/3 of the face when we are dealing with skin quality and skin laxity, okay? Of course, yes, you can also inject Karisma on the forehead, okay? If you want to inject it on the forehead, and if you want to do it with the needle, there are a few points that you can do. The first point is, let's say, 2 centimeters higher than the most prominent area of the eyebrow, okay? The highest area of the eyebrow arch. You can do 1 injection here, you can do 1 injection on the other side, and you can do 1 injection in the middle and then massage it if you want to do it with the needle, okay? I don't do it with the needle. I never do it with the needle on the forehead because I don't find it comfortable for the patients, and I can spread it more evenly if I do it with a cannula, if I need it. But the forehead is one of the rarest areas that I actually treat with Karisma. I have other modalities for this part, but you can do it. You can also treat the forehead. Don't treat the glabella. Never. Doesn't matter which kind of product. Botulinum toxin, yes, it's okay, but any other products in glabellar region are dangerous, very, very dangerous. And with Karisma, don't treat the tear trough, okay? As I said, in Asia, they also treat tear trough with Karisma. It's off-label, okay? This is completely off-label. In Caucasian population, we are much, much more prone to edemas in the tear trough area. And if you promote neocollagenesis, and if you put free HA in the tear trough area in the patients that already are prone to edemas, you will get malar edema, and it's very hard to get rid of malar edemas. Okay. Interesting thing, you can also treat lips with Karisma. I wanted to save this for the end, but as we're talking about it, yes, you can treat lips with Karisma. You won't get the volumizing result. You won't get the big volume as you can get with some fillers. So it depends on the patients what they ask of you. But many patients, they've had their lip treatments done and they have good volume, but they want some refreshment. Okay, so we can go with some mesotherapy treatments, okay? But you can also go with Karisma. It will give you hydration. It will give you plumpiness without the concern of migration. And it will last much longer than maybe other products that are only HA based, okay? When treating the lips, I never go over 0.5 to 0.6 is maximum for both lips. Okay, this is the maximum amount. When I treat the lips, I always mix it with the lidocaine, okay? Because otherwise it can be quite painful. It can sting. Okay. John is going to be a model today. Because he says it doesn't hurt. He says that there's no pain when being treated with Karisma. So he'll try it today. Okay, let's continue with the 10-point technique. So I've already mixed my Karisma with John, cover your ears, with lidocaine. I take from around 0.1 to maximum of 0.2 ml of 1% lidocaine and mix it with Karisma. It's not necessary. Okay, it's not necessary to do it. It's very important to do it on the live demo. Just kidding. But so the injection, it's painful. It's logical. When you inject the skin, it's painful. Even if you put a lot of anesthetic and numbing cream on the face, the patient still feel a little bit of pain. So when you inject any kind of material that is a little bit stiffer, it stretches the skin, and this is the part where it hurts a little bit, and the pain, the sting can last for a few seconds. If you mix lidocaine, you shorten the time of that post-injection pain. You can also do it without lidocaine. Some patients don't even feel it. They say that it's not painful, that it's quite okay. Some patients, are very sensitive. If you don't want to use lidocaine, you can use ice cube. Put it on the skin for 3 to 5 seconds, and you inject Karisma and move and inject and move and inject with an ice cube. You numb the pain receptors with cooling. Okay. I'm going to both sides anyway.
Yes, definitely doesn't you want to side?
She didn't say if, how she's paying. So if she's paying for both sides or not. So
Yeah, please.
okay, we'll clean it up. I always clean the markings off when I inject the patient because those pencils aren't sterile. They aren't clean. So I always clean the whole face. Okay, so Karisma has a pre-packed needle, 27 gauge, 13 millimeter needle. Don't go perpendicular to the skin, you'll be too deep, okay? Go angled. You inject around you go deep around one third of the length of the needle, angled in 45 degrees, okay? So you stay in the deep dermis. I'll do it from this side so that I don't block the view on the camera. Okay, so we said the first line it's a crossing from the ala to the hairline, and the lateral brow to the mandibular angle. This is going to be around here. We inject. It's a deep dermis. You don't have to pull the skin up. This is just for you to see is the deep dermis. The needle must not be visible underneath the skin. So if you see the gray color of the needle, you are too superficial. And we are going to inject 0.1. How's the pain?
It's not bad.
It's okay. And we can massage the area. I don't think you will see. Where am I? No, it's not focused. So you will when you'll use Karisma, for those of you who haven't used it, you go from one long line to the short line. This is 0.1 ml, okay? And it's quite hard. So the second line, the second injection point is the crossing from that zygomatic line and from the lateral canthus of the eye, and we inject 0.1. Are you okay? Yeah, okay.
It's fine.
I'm also okay. Thank you for asking. Okay, is it visible? And the third is from mid-pupillary line to the mandibular ligament, and we inject 0.1. And that's it. And the first line is practically done. And you see that there is almost no bleeding when you are staying in the deep dermis. And then the next injection point that I'll do, it will bleed a lot. You'll see. That's because I said this. Okay, so we go. There is around 2 to 3 centimeters lower than the first line. So the line is from tragus to the lateral corner of the mouth, and we inject again 0.1 into the deep dermis, and another point in the crossing, and one more here. I advise you to stay at least 1 finger width away from the modulus, okay, from the mouth corner. You have the crossing of the vessels here, so I don't advise injecting it too close to the mouth corner. Okay, we go to the mandibular angle. You go approximately 0.5 centimeter up from the jawline on the mandibular angle, approximately. You're over the masseter, so when you chew, the product will spread evenly on that area. You ask your patients to chew. Okay, now you did it. So you go anterior on the anterior border of the masseter, still basically on the jawline, and inject 0.1. And again above the mandibular ligament, deep dermis, 0.1. And the last one, you know this point, it's quite famous. And we inject 0.1. How was the pain?
It's okay.
Tolerable?
It's not painful, no.
Agnes, is she following your rules?
I'm pretty satisfied.
You are? Okay. So she earned the other side?
I think so, yeah.
Oh, thank you, Agnes. Thank you very much.
Okay. A little bit of blood is normal.
Oh, and 3 coffee today, that one is probably.
What? You?
3 coffee today, that one is.
You have high blood pressure, huh? And 2 aspirins, just in case. Okay, and we can go to the other side. Are there any questions for now? No questions. Is it that boring or yeah?
To our feet to the highest lines, it was 0.5.
0.1 in each injection. So you in each line you inject 0.3 in total on each line. Okay? So you have the first line, we can draw it again, no worries. So the first line goes from
Choose one
here.
each side.
1 ml each side. Yeah. So first line, we have nasal ala to the hairline alongside the zygomatic bone, okay, a little bit lower. The second line from mouth corner to tragus, and the third line goes on the jawline, okay. And then we have the first the perpendicular lines. It goes from lateral eyebrow to the mandibular angle. This is the first one. The second one from lateral canthus to the anterior border of the masseter, okay. So this is the second, and the third, I said 2 to 3 millimeters lateral to the mid-pupillary line, or on the mid-pupillary line. It's not that important, to the mandibular ligament, okay. And the 10th, in the, let's say we can draw a quadrant, okay, from the marionette line in the middle of the lower lip, and in the center you inject 0.1. Okay.
That's my question.
Clear?
But I'm guessing when you're placing them,
Yeah.
that probably is a
I'll show you something.
you could.
That's my anatomic specialty. I can't make my thumb straight. You see, I can only make it like this. If I raise it up, it goes down. So this is very, very good for surgery and very good for injecting. Maybe that's why I'm the trainer. So no, but really, yeah. So I'm always using the joint. Thank you. I forgot the word. The joint. Basically, I do it with the joint. But when I inject, I don't only push. I also pull, if it makes sense. So I don't only push down. I also pull back, and I also use I use my left hand to help me. So I always stabilize my needle, my syringe, with my left hand. If you inject with one hand in the air, you'll never be able to inject stiff treatment, stiff products. Yeah. So always use your left hand. Also, your left hand is your tool, and not only your right hand for inject. I mean, if you're working with your left hand, then it's vice versa. Okay. Okay. I'll clean you. How are you feeling? Numb on that side of the face? No. It's 0.1 ml of lidocaine. That is a very, very, very small amount. So it's just to reduce the afterburn effect of the product. And the product doesn't hurt at all. There's no pain. Yeah, John. Bravo, John. Okay. Okay. So.
Injectable.
What is?
The only painless injectable. So you get a stick. Everyone.
All right. So again, we start with the first point, the first crossroads of the lines. We go in the deep dermis. You see, with my left hand, I'm helping, and I inject 0.1. The second point, deep dermis, is the crossing of from lateral canthus to the anterior border of the masseter. Okay. The third, in the mid-pupillary line to the mandibular angle. This one is the most painful, alongside with the one inferior to the lower lip. Okay. Again, from tragus to mouth corner, the first line, and the first injection point on the crossing of that lines, I inject 0.1, and on the second point again 0.1 and 0.1 near the mouth corner, approximately one finger width away from the oral commissure. We go on the mandibular angle, approximately half centimeter up from the jawline angle. Then we go anterior, on the anterior border of the masseter, 0.1, on the mandibular ligament, or let's say over the mandibular ligament. And the last injection point, my dear Ivona, We go in the center of the, let's say, lower lip quadrant. And that's it. That is our 10-point technique. If we look at this side, you see there are basically no papulas visible. It's a little bit of redness. We'll clean you up and you'll be able to see in person in the next few hours how the product behaves. In my opinion, this can be also a lunchtime procedure in many patients. If you have a patient with a very thin skin, then of course it makes sense, it's more visible. Okay. Let's clean you up.
So you would only get the package that was not fun.
Yeah, I mean you feel the papules. It's normal, but they're not as visible as with treatments with too superficial treatments. Yeah. Okay.
You say with the needle in one point?
Yeah, in 1 point. No, never. No, in 1 point. I stay in 1 point, and I inject in a bolus technique. If you move your needle when you're angled, and if you inject retrogradely, you will be too superficial at 1 point. Okay, and where you're too superficial, you can get adverse events, adverse reactions. You see, if you stay in the deep dermis, there is almost no bleeding. It's a very low chance of hematoma. Agnes, do we have some post-procedure cream or something that I can put on the face? I usually use some other brands post-procedure. I won't say it out loud right now. Thank you. That's only because Karisma doesn't have the true post-procedure cream. Otherwise, I would use Karisma's post-procedure cream.
I'm sure they're going to make it.
They will make it for sure. They will make it for sure.
Still.
I will talk to John and Filippa about this. When you massage the area, you feel some small papules, but they are really barely palpable. The most visible ones are always, on the zygoma here. If you put too much product on these parts, if you were to put 0.2 or 0.3 ml here in one bolus, you will get the alien face. So that's why 0.1 is, in my opinion, the best volume to inject Karisma, because you get, let's say, low quantity of injection points, but you get a lot of product in one injection point, but enough of it to spread throughout the whole face. So I think it's a very good, let's say, compromise. Okay, that's it. You are done. Bravo.
Should go for you. Still right. Nobody ran had seat them.
So, when treating the neck, as I said, the clavicle is our main point of interest. It's a safe point. You never go lower than that, and then you go approximately 2 finger widths over it. Okay. So this is the lowest that I treat on the neck. I don't go lower than that. Okay. So approximately 2 finger widths. That is 3 to 4 centimeters over the clavicles. Okay. It depends on the patient, on the length of the neck and everything, but you don't treat lower than this in order to not have the adverse reactions of that redness. How I treat the neck, I always look at the lines that are already visible, okay, and I first treat the lines directly, and if I have any product left, which is very rarely, I also do the skin in between the lines. But in the first treatment, those lines are my main point of interest. Okay, so my dear Eva here, she doesn't have any lines on the neck. You don't.
I do.
Who agrees that she doesn't have any lines on the neck? Everyone agrees.
There and there.
You need a really big glasses
No, I see them every day.
You see them every day, don't you? No, your skin is very, very good, and the lines could be much more severe. Okay, let's clean the neck first. I'll treat the neck with the needle. You can also treat the neck with the cannula. Because the skin is thinner, the cannula on the neck can be a little bit more tricky. And in my opinion, even could be a little bit more painful. But as I said, I like my needle also on the neck because I get the stimulation from the injection itself. It's not just the collagen inside, but also when you stimulate the skin, when you damage it, controllably damage it a little bit, you get neocollagenesis. What's also important, as maybe I didn't say before, it's not just the collagen that we need in the skin. So the collagen by itself doesn't do much, okay? So with collagen you need also elastin and you also need hyaluronic acid, okay? So you need both, you need all three things in order to improve the skin quality. Okay, so with Karisma you also get the elastin production, okay? All right, let's, yeah, it's visible? Visible, perfect. All right, I have a little bit more of product because I mixed it again with lidocaine. So we'll go in the imaginary lines that Eva sees and we inject into the deep dermis, okay? Here you can inject in a retrograde manner, but stop injecting near the injection point, okay? So don't inject in the injection point because you will be too superficial. You can also do a bolus technique. I inject approximately 0.05 in each injection point, okay, to maximum of 0.1. I don't go higher than 0.1 in each injection point. Okay, so we'll imagine that there is also a line here.
That's it.
And we'll do it like this, okay? How's the pain?
It's okay.
Of course it's okay, you're Slavic. You have a high tolerance for pain, as we all do.
I had a few shots in the bathroom.
What did you...
Yeah, nothing.
Few shot? Okay. I have a microphone here, you know? Is it...
They can cut that out.
You admitted it on camera now. Okay, let's imagine one more line here. Any questions? No questions, okay. Again, very important to stay in the deep dermis.
Okay.
We'll go in between those lines here. With the cannula you can treat larger area, yes, but in thin skin like here, with the cannula it can be quite tricky because that the skin can get in your way, okay? And in the neck you have to go around the corner in order to treat the whole area. We'll go also underneath the jawline, so improve this area, the area here. Don't worry, you can also go in the under chin. You won't cause any problems. Okay, we go on the other side. Again, we're going to treat our imaginary lines. Let's go also on the right side. Staying in the deep dermis, you see when I raise, the needle is not visible. Okay, so I don't see the grayness of the needle. We have a vessel here. We don't want to cause a big hematoma. But on the neck, hematomas are much more common than on the face because of the thinner skin and thinner subdermal tissues. We'll do a bolus here because you have crossing of a few vessels. How's the pain?
It's getting worse.
It's getting worse.
I think the needle is not sharp.
You can also change you can change the needle for the other side. I didn't. I'm so sorry. But you have just three more injection points left. So 1 and 2 and 3, and I light. It's gonna be the fourth one.
But don't forget you have to
Done.
Oh, thank you.
It's done.
Thank you for the
It's
face.
done.
just let them rage it. And you want to go.
You know, you have to feel something. If you wouldn't feel anything, then
I
it would mean I didn't. Yeah, you would think that I'm doing nothing.
You know?
What?
You would have to check her pulse if she wouldn't.
Yeah. It's normal. You're alive. You have to feel something. Okay. One more important thing after the treatments of the neck. This is a medical one. If you massage only one side of the carotid bulbous, you will get bradycardia. The patient could go to cardiac arrest. If you must, it's true. And so you lower the pulse. So you always massage both sides at the same time. Okay, never just one side. Both sides always. Okay, and don't press too much over the carotid artery. You just massage the skin. If there are some papules left that you want to massage, you do it like this. You squeeze them in between your fingers and massage them. Never press on the neck, okay? You always massage gently on the neck and always both sides of the neck, okay? And if you want to disperse the product even a little bit more, you do it only pinching the skin. That is truly very important. It's medically important. Yes.
And we saw in your presentation the lady which was a model of the neck protocol, but she was much older.
Yeah.
So what is the amount of the product you have used for the older lady?
2 ml, always 2 ml. For, let's say, if I treat the neck, I only use 2 ml. I never use more than 2 ml in one session.
Doesn't need.
No. It's better to do more treatments than to do it too much in one session. Okay, because here we're not only talking about in polynucleotides. You need the amount of polynucleotides in order for them to work better. We have signaling here. Okay, so the amount of product is important that we put inside the alpha-1 chain, but you have the signaling effect. So if you were to put 4 ml of Karisma, you would get more hydration, but not necessarily more collagen, because you have a limited amount of fibroblasts in your skin, in your dermis, and you can't produce more than a certain amount because we are not putting the end product. We're putting something to stimulate your fibroblasts. So it's better to do it if the skin is older, space it 3 weeks apart, do 3 sessions, you will get better results than doing 4 ml in one session. Okay?
So you can do 2 milliliters on the face and 2 milliliters on the neck
Yes.
at the same time, and 2 milliliters on the hand.
You can do that in one treatment, yeah. Just for one area is 1 syringe is more than enough.
You can do it on elbows, you can do it on knees.
Yes.
You can
Yeah,
do it
yeah,
on
yeah.
in the thighs, you know,
This
sometimes
is off-
after the weight loss you've got like the skin, so you can do it
Yeah.
the body.
This is off-label, so this is off-label use, but you can use it on stomach around the belly button after pregnancy. You can use it on the elbows, on the skin here, over the knees. So you can use it in other parts of the body. I've used it on the arms, so almost everywhere. You could use it almost everywhere because it produces your own collagen and it doesn't cause scar tissue. So that's why you can use it in other parts of the body also.
Can we just mention the scars as well, because it's amazing.
Yeah, but this is extremely off-label. But yeah, we can. Some doctors, I'm not, but some doctors are using it for the scar treatments also. Okay, we'll continue with the cannula treatment. Okay, so I'll show the cannula treatment on the face. I usually use 22 gauge cannula. It's either 50 or 70 millimeter cannula. It depends on what you prefer and which areas you want to target. As I said, the longer the cannula, the less injection points you may need, but the longer the cannula becomes more flexible. Okay. So usually what we can do with 2 or 3 injection points. I start with the injection point on the most prominent part of zygomatic arch of the zygoma. So my injection point is going to be here, and from this injection point we can go over the whole mid cheek area. We can go in the middle cheek. We can go to the mandible angle. We can go to the premaceteric area, or the preauricular area. We could also go a little bit up to the temporal area. Okay, so this is the first injection point. The second injection point that we are going to be making is on the mandibular angle, approximately 1 centimeter up and 1 centimeter anterior to the axillary mandible angle. Okay, from this injection point we are going to do a little bit of the crossing of the lines up here, and we're going to treat this area also. We'll see sometimes with 70 millimeter cannula we can also achieve the pre-marionette area here underneath the lip. So we'll try to do it with 2 injection points. If not, we'll do another injection point in the mandible ligament. Okay? Any questions? You're scared of the cannula, I see. Cannula can be your greatest friend or your big enemy if it's too flexible. Okay, I usually use TSK cannulas. I find them more stiff. You can go, I'll clean you first, like this, yeah. So TSK cannulas I prefer because they're stiffer than other cannulas. And another thing, the opening of the cannula is very close to the end of the cannula, because in some other brands of cannulas you have 2, 3, 4, sometimes 5 millimeters behind the ending of the cannula, you have the opening. So you can't be as precise as with the TSK. Okay, great. I've cleaned you, put my gloves on. Okay. Again, I pre-mixed the Karisma with 0.1 ml of lidocaine. I always bend my cannula a little bit. You see? Is it? I can't show you like this here. Where am I? Okay, so you see the cannula is bent a little bit. Yeah, it's 22 gauge, 70 millimeters.
It's real.
Okay, and we'll do injection points. I always just puncture the skin, nothing more than the skin. You don't have to go deep and rotate and go to the bone and puncture the patient, or leave the needle inside. Okay, so we just pinch the skin, and I just go through the skin to the dermis. That's it. Everything else I'll do with a cannula.
Okay.
And we go in, and we stay superficial. How do we stay superficial?
In this one.
You extend the skin a little bit, you tighten it, and now we're in superficial compartments. Okay? Does it hurt?
No, not yet. It's right here.
Okay. And we inject retrogradely, and we fan it out. Okay? You see how the cannula bends? That is because it's not TSK.
Do not.
I'm just kidding. Okay? You've had some other biostimulatory treatments done before?
Me, yeah.
Yeah? I can feel it. So if you treat with a cannula, and if the patients have had previously any other biostimulatory treatments done, it will be harder for you to pass through with the cannula. That is normal. That's what you wanted to achieve with the other biostimulatory treatments. Okay, and we inject the whole area. You see, we're staying superficial, and we inject in the retrograde manner. Okay, from the same injection point, you can turn, and you can also treat the temporal region. Okay, this can be a little bit more painful and a little bit more challenging. You see, there are really small vessels here. You must be very careful. Even with the cannula, you can perforate a vessel. You can do a very big hematoma in this region. I don't know if it's happened to you. It happened to me recently, like a big hematoma here with a 22 gauge cannula with the PLLA, and it wasn't nice. I took out the cannula like this, and the blood was just going out. Yeah, it happens, you know. You just, if this happens to you, you put the pressure on the area and wait it out. Okay, wait it out a little bit.
So,
Ian.
use sculpture in that area to add some thickness.
Yeah.
How does this compare to lactol? I know it's a very different product, but
Yeah.
will you get a similar effect?
Not really. I mean, you will, with Karisma, you improve directly the skin quality. With PLLA, you induce more neocollagenesis that is more visible in fibrosis, in scar tissue formation, which is not bad. Okay, it's not. This is not negative. With PLLA, you will get more of that tightening and lifting effect, but you won't get the improvement in skin quality as much as you get it with Karisma. Yeah, it's a different pathway, the different mechanism of collagen stimulation. You get the tightening of the skin from both treatments, but Karisma actually addresses also the direct skin quality, not just tightening of the skin. Okay, so let's do another injection point in the mandibular angle. Is it visible on the camera? Yeah?
Yes.
One injection point here. Again, just perforating the skin. It's not necessary to go too deep. Okay, we want to stay superficial, like this. This, you see, with the 70 millimeter cannula, we will be able to go even in the lower lip area, not lower lip, but here in front of the marionette lines. We do a few lines here, and then a few lines over the jawline and behind the marionette. From this point, you can again also turn and go into the preauricular sulcus or preauricular area. You can see a lot of hollowness in this area. You can treat it with a combination of Karisma and combination of some very soft fillers. With Karisma, you will get the tightening of the skin and improved skin quality here, but you won't get the volume. Okay, so with Karisma, you can easily and really effectively also treat the patients that have hollowness in the middle cheek, you know, or the patients that went through severe fat loss. You see them with those kind of bumps, and with Karisma, you can treat it nicely. I've seen that it adds a little bit of volume, but it's not the kind of volume you can do with fillers. But you're very safe with Karisma because you won't get the heaviness of the face. Okay, so you can treat the whole area, and that's it with the cannula. And we can then massage the area, and you see, if you treat with the cannula, there is practically no downtime. There are no visible papillas and no other reactions on the skin other than redness from my rubbing. Okay. Other side?
Yeah.
Or we finish now? Other side. Okay. Okay, any questions? No questions. Again, either boring or everything clear. And I hope it's the latter. Okay. We'll clean the face, but this is going to be a little bit more challenging for me now, treating for this eye, because I can't do it from the left hand. I don't know, you stay like this. I'll just cover the direct view. I'm really sorry, I can't do it the other way. Okay, I just puncture the skin. Sometimes you see people rotating the needle, leaving the needle there, doing all sorts of magic with injection point, but it's quite easy. You have to go through the dermis. That's it. All of the other things you can do with the cannula directly. So we go here, and we go superficially. You see why I bend the cannula? Because I avoid the skin contact. Okay, so it's much safer, much cleaner, much more antiseptic. Because otherwise the hair gets in the way, the hairband gets in the way. If you bend the cannula a little bit, it's much easier to treat. Okay, you've had a lot of treatments of biostimulation done, I see. It's very hard. You can feel the clicking and the resistance, which is normal. That means that all the treatments were very effective in your face. Again, I'm always injecting in a retrograde manner, and I stop around 1 to 2 centimeters before my injection point. Why? If you inject all the way, then you will get with a lot of product in the injection point. Understandable? Yeah. Otherwise, you just get a big bump of product at the injection point. Okay, a lot of fibrotic tissue. Nice, cool. And again, we inject in a retrograde manner. And again, from this injection point, I can just turn around and go over in the temporal area. Okay, yeah, this can be a little bit more sensitive area. Okay, and we inject superficially, anywhere from 0.1 to 0.3, depending on the patient. If they have more hollowness, you can treat with a little bit more volume of the product. But again, Karisma won't give you true volume. It will just hydrate, tighten, and repair the skin. And you can get a little bit of soft volumizing effect, but not directly due to the Karisma, but due to better hydration and due to better skin tension. Okay, and we do another injection point. As we said, on the mandibular angle, we have a capillary here, so I'll go a little bit anterior to it. I don't want to give a big hematoma to you. Okay, and we tighten the skin and we stay superficial. And from this injection point, we can proceed. Probably we can proceed because it's very fibrotic. Okay, here we are. And we'll get the deposit here. And then over the jawline. And we'll turn around and go in the preauricular area, because it's easier to go in the preauricular area from the inferior part of the face, because here you have the zygomatic ligament, which is it's one of the hardest ligaments in the face, and it's very hard to go through with the cannula. So it's easier to go into the preauricular area from the inferior part of the of the face. And we inject the rest of the product. Because I didn't go directly on the mandibular angle, I will put some small aliquots also here. And you're done. Bravo.
Sure.
We should have done half with the needle and half with the cannula, so the patient can say which one is worse. But you see, there is no visible papillus, so practically no downtime. Again, my cream here. That's it. And I always massage my patients a little bit. If I give them pain, I give them also a little bit of pleasure after the treatment. Okay. And those are just 2 injection points, and you can treat practically the whole face. If you want to make it easier for you, you can do 3 injection points, especially if you want to target the lower lip area. Okay, so I treat hands with a cannula. So I do one injection point. So I always look where the main vessels are. Okay, and you have good skin, and I just puncture the skin. Okay, nothing more than that. Again, I bend my cannula. It's a 22 gauge cannula, 70 millimeters. With that, I can reach the whole hand surface. Okay? Does it hurt?
No, I'm not looking. It doesn't hurt.
You don't need to look. So I go in between the tendons.
No, it actually doesn't hurt.
No, it doesn't. It actually doesn't hurt. It looks worse than it is. Trust me. It's not like I've tried it on myself, but
It's actually okay.
it's okay. It looks. I'm telling you, it looks worse on the camera than it's.
So you're going to do the other hand with the needle?
No.
No, with the with the cannula only. So I inject in a retrograde manner, again fanning it out on the whole surface. I'm very careful of those superficial veins. So I got a few questions while doing workshops. If you can inject also the skin between the knuckles on the fingers, and the answer is yes, you can, but it hurts, and I don't really see the true benefit. Why? Because this is the area that gets bent a lot. So I mean, yeah, you can improve skin quality there, so you can treat it with Karisma without any risks. But yeah, it's a sensitive area.
And how might you stack this with something like CO2 and the...
Yeah, I mean, you can. Or are you asking how? You know, you space it apart again. 3 to 5 weeks before CO2, then you can do your treatments. It's a, let's say, a pre-CO2 procedure.
Yeah.
And then one more after, when the skin, of course, is completely healed after the laser treatment.
Yes.
Okay. And that's it.
Done.
Yeah, done. I'll massage the area later with the cream, because I'll get the cream on my gloves otherwise, and we'll see the end result. Let's do the other hand also. It's painless.
It's not literally. You feel a little scratch and then nothing. Yeah. So really good.
Can we lose? Yeah, the hand. Thank you.
That's good interest.
Yeah. Perfect. Agnes, you're so brave.
I know. Now that I know it doesn't hurt.
You're the bravest boss in the world. Okay, we Again, just go through the skin. We find our injection point. If the patients feel any pain or something, you inject a small bolus. If you mix it with lidocaine beforehand, you inject a small bolus, the pain will go away, and then you just proceed. Is the same when you treat the face with the cannula. If you come to any point of resistance, you just inject a small amount of product. It will hydrodissect the area, so it will remove some of the, or let's say move away some of the fibrotic tissue, and you will easily glide through with the cannula. Okay, so these are some tricks. The next trick, when you see some resistance, let's say like this, you don't push the cannula through for a long time. Okay, if you see that after 2 or 3 tries you can't get through, you do it like this. You take your index finger from your non-dominant hand, and you see, you go. I'm blocking the camera. Very good. Is it better now?
Oh, yes.
Oh, now it is. Okay, so I'll do it with my other hand. So if you come to the point of resistance, then you don't push with the cannula through too much, because you will damage the tissue, you will get edema, you can get hematoma. You get your non-dominant hand and you just do it like this. You basically, let's say, pull the skin over the cannula and not vice versa. Okay? The angles I have to be injecting from the live demos. You see? Look at this. Look how I'm doing.
Amazing.
It's like a backhand. It's like I'm Novak Djokovic. Okay. My dear,
Perfect.
you
Thank so
are
much.
done. I'll just massage it, and you'll see there is no bleeding, no hematomas, no nothing. Yeah.
Lost.
Oh, we're far away.
Please.
I'll just put some cream
Yeah.
here. And you just massage the whole area, and that's it. You'll get the great volumizing effect at first because of the 1 ml of the product, but then you get really good hydration. The hyperpigmentations that are here are going to be less visible, especially if you...
What pigmentation?
No, the small hyperpigmentations that you have.
more.
Everybody has some sort of hyperpigmentation of the hands. It's because of the sun exposure. It's normal.
Let's move the topic.
Okay. Here,
Thank you so much.
it's done. Look at your hands. Show your hands.
I don't know if you can see.
No, it's not. It's not. But the results are immediate, and then after 2-3 treatments, you get the long-lasting results. Today I'll show you everything, all the secrets, everything in one session. You see that?
What a good organization.
That's amazing. Okay, for the lip treatments, I take 30 gauge needle. You need a lot of extrusion force, okay? A lot. You can also go with the 27 gauge pre-packed. It will be much easier, but it's a bit more traumatic for the patient. Traumatic in sense of the bigger the hole, the bigger the chance of hematomas and bruising. Okay. She didn't have her numbing cream, but to be honest, I don't believe that much in numbing creams. I think they're more placebo effect because the main pain comes from the stretch, from the stretching of the tissues. Okay. Visible? Visible. Okay. So, first thing to know, it is not that important to get the best symmetry in the world because we are not creating true volume with Karisma, okay? You inject, let's say 0.1 in each quadrant, so in each part of the lip, okay? To maximum 0.15, that is the, especially in the lips that have volume. Okay, so we go under the vermilion border, to the lip tubercle, and we inject in a fanning manner. Does it hurt? Of course it does.
No, not what.
I will inject approximately 0.1. I will go to the cupid's bow, and that's it. And it's done.
So easy.
So easy. It's very easy. Okay, is it visible if I do it like this? Yeah? Okay, again, I inject above the vermilion border, go in the area that is most prominent. It's called the tubercle of the lip. And again, I go in a fanning manner because I want to spread my product. You could also go with the bolus technique. It's not wrong. You will just have to massage the lip harder after the treatment, okay? I'm spending that much time in the tissue because it's a very, very, very high extrusion force with the 30 gauge needle, and I have to be careful not to press too much so that I don't have an explosion. How are you feeling?
All right.
Yeah?
Not painful at all.
It's wet spring.
It's not.
Just chicken.
Okay, you okay? Okay, let's go to the other side. Again, we inject. We go to the tubercle. And we slowly inject in a fanning manner. We are staying superficial. Why? Because we want to stay superficial because of the vascular dangers that are in the deeper regions of the lip, in the deeper layers. Yeah? And we go in the lower lip also. And again, we slowly inject superficially. And we won't get the volumizing result in the long run, but she will have better hydration and plumpiness of the lips. And that's
We
it.
do feel a bit numb.
Yeah, it's normal, and it's normal that it's a bit numb because I put lidocaine inside. It's for your comfort, trust me. Otherwise, you would be running from the table. And that's it. And I've injected 0.4, so 0.1, 0.2 in the upper lip and 0.2 in the lower lip. And that's the magic. It's not that hard, is it? It's easy. Yeah, it actually is easy. You just see a little bit of plumpiness right now, and a little bit of edema, and that's it. And whatever is left, I will just use on the face, and that's it. I'll just spread it around in the few injection points. So let's go in, and we'll do 0.1. We'll go 0.1 again. Because we don't have the whole ml, we have to adapt our 10 point to, let's say, 6 point. And we go 0.1 again, and 0.1. And we will give 1 to support the lower lip and the marionettes. And on the mandible ligament. Yes. And we'll go to the other side. Okay, can you turn your head for me? Thank you. And again, 1, 2. Again, you see I'm staying in the deep dermis. 1, 2. 1 here. The mandible, and we'll finish with our support for the lower lip and the marionette lines. A little bit. Yeah. It's done. It's not bleeding anymore. I've had all of my patients were so brave today. Any questions for the lips maybe?
What about smoker's lines?
Smoker's lines, you just go there. We didn't have the patient with smoker's lines. You treat it directly. You can treat it directly with a needle. I prefer this method. If you have heavy smoker's line, first you go with the cannula to make, let's say, a subcision or separation of this fibrotic tissue, and then you can inject with the cannula in a retrograde manner, fanning technique. Okay?
And what would you do with the folds? With the fold in there?
That you can, but folds are mainly a volumizing problem. Usually volumizing of the mid cheek area. Okay, and if you do the folds, you can treat it with Karisma, but not really the folds that are deep. But if you have like a line, like not a true fold, but more like a creasing of the skin, then you can treat it with Karisma. But otherwise, I suggest you treat nasolabial folds with filler. Okay.
If you do it, you will put a cannula in there. So.
No, I would treat it with the needle. That's my technique. But usually I treat nasolabial folds with filler and not with Karisma.
Well, don't touch those things.
I will clean you, and I will massage your face and lips a little bit. Okay.
Yeah, okay.
All right. Karisma in lips spreads really fast, really quick, so you don't have to massage it like lip filler. Okay. You will look superb.
Thank you.
Okay.